Welcome back to your health, wealth, happiness, and spirit. Today we will be talking about skincare. Dr. Sadiq joins us once again to help answer some of our questions. Hello, thank you for coming again.
Hello, thank you for having me. It's always a pleasure to be with you.
Of course. Now, the first condition that we'll be talking about is eczema. Can you tell our audience a little bit about what eczema is?
Okay, eczema is a condition that causes the skin to become itchy, inflamed, sometimes red, sometimes it becomes very hard, and the symptoms can be different in different people. I have eczema, and I actually, even sometime on my arms, it looks different, and if I have on my neck, it's different. So it can be different at different parts of the body. It can be different on different people. So that's what eczema is actually.
Now, if somebody does have eczema, what kind of symptoms should they be looking out for?
Sometimes they start with just simple itchiness. That's number one. And if you start itching, oh my God, that's what I do. So if I start itching and then it becomes red and then it becomes dry, and it's actually literally, I can show it's a kind of a sometimes dark, hard, and you know, if I continue itching it's like can be very, very difficult. So itchiness, look for itchiness, and don't actually itch. Then you can actually stop it right there. But if you get into the itching, then skin become dry, and it's also leathery, and it's sometimes if I really am doing it, I itch a lot, then it can also be very, very sensitive and crusty, and sometimes if you don't stop, then it will also start oozing. Then if we don't take care of that, it become infected, and it can cause skin infection, which we call cellulitis. So one thing leads to another. So don't itch.
Now, that's a lot of symptoms to be looking out for. Now, what should somebody do if they begin to have these skin problems or they suspect that they might have eczema?
I would recommend people to just seek the advice from the doctor, and also, if possible, dermatologist, instead of trying different things in the beginning. Once they diagnose it, it's a eczema, or it can be something else. That's also a possibility. Then you must see the doctor. And once the doctor find out it's eczema, it also cannot be that easy that one medication will work for everyone. So it's a hit and trial actually. Some things works for one person and the other things works for the other person. So everyone is little different. So it's a very difficult disease.
Now, is eczema something that can be cured with medication?
Unfortunately, we cannot say cured, but I would not also discourage people that it cannot be cured. My sister actually, she had a long lasting eczema. So she tried everything, steroids, creams and everything. It wouldn't go away, but somehow olive oil worked for her. So simple olive oil, she would just like put it on her, it was on her legs, and it was bad eczema. And trust me, she has cleared up. It's a shocking to see that how her eczema has gone away. So yes, if you find the right treatment for yourself, that is the key, and that's it's your luck.
Now, is medication the only option, or such as you mentioned, olive oil? Is there something else that people can use at home?
Yeah, I think sometimes we just do simple things, like when you take a shower, just afterwards moisturize yourself. If you keep your humidifier on, if it's a heat in the winter season, I have a more itching than the summer season, because the humidifier, if I don't turn on humidifier, it's really a bad thing. So doing simple things are very, very important. Any moisturizer over the counter, whatever works for you, that's very good. But sometime I personally use olive oil. I'll just, every time I wash my hand, I try to put, I have moisturizer or olive oil in everywhere possible at my home. So I think that's what I'm going to recommend. Use coconut oil, aloe vera, apple cider vinegar, sometimes people also using. So find a right thing for yourself, but keep your skin hydrated and clean, and try to find things which are causing it. That's also very, very important.
Wow. Now, so for our viewers that have some dry skin issues that is not related to eczema, can you address some tips for them?
Yeah, dryness is very actually crucial to take care of. If we do not take care of dryness, then it can lead to eczema. So how to take care of our dryness can be very simple. First of all, take care of yourself. Taking care of means that whenever you are washing your hand or face or taking shower, make sure you moisturize your body, face, hands all the time. And also when you are out from a swimming pool, make sure that that's extremely important. Take shower, and after the shower, do moisturizing. And one of the most important thing which I must stress on, the drinking water. Keep yourself hydrated. Sometimes people are not drinking enough water. That can be only reason. They are not drinking like enough, like at least I would say 2 liters of water will be good enough for you, because when we perspire, we are losing water from our breath, from sweat, and we need water to keep our body running. And if we are dehydrated, we would not know, but you will start having itching. That can be one of the sign of dehydration, itching and dryness. So keep yourself hydrated. That's extremely important.
I see. Now, moving on to another prominent skin care issue that a lot of people in the US deal with is acne. Now, can you tell us a little bit about that?
Yeah, acne is actually very common problem, especially in the young age, when the skin we are growing, and we are kind of get our hormonal changes, and we have lot of glands under our skin produce lot of, and you can say secretions, and sometimes if the pores of the skins are closed, they start kind of it doesn't come out, so you start getting this inside closeness of those secretions. So we have to let it, number one, we have to know what acne is, and I would again recommend people to go to the doctor. It's good to see the doctor, and they can actually tell you that, is this acne or is something else, and how to treat it. So washing your face, keeping your skin clean, that can be number one treatment. Cleaning, and especially when people wear makeup and they don't take off the makeup, that's also you closing the pores. So keep the pores open, clean, wash it, frequent washing of your face and putting moisturizer, and also some you can use any cleanser over the counter, whatever is suiting your body.
I see. So again, it just depends on what might work best for the individual.
Absolutely.
Now, what would you recommend to someone whose acne persists through even over-the-counter medicine?
Yeah, those people must see the doctor, because there are some actually special type of medications and soaps, and some over-the-counter soaps have special niacinamide in them. So if you are using over-the-counter, make sure that component is in the soaps or in the liquids which you are using. But I must say that if you're having this acne problem, don't try different things and end up having the acne getting worse and worse. So please see the doctor.
I see. Now that's some great information that you gave us. Now, why don't we focus on some true and false questions for skincare? Okay, so first, true or false? Clothing can affect your skin.
Yes, it can. Especially this synthetic fibers, polyester, nylon, they can be problematic for some people, but not for others. So everyone behaves differently, but cotton is preferably. If the people are having problem with polyester, I would recommend they should wear cotton, or they should actually not wear the synthetic cloths.
I see. Now, what about the detergents that we use? Can that also have an effect on our skin?
Oh, absolutely. Detergent is actually one of the most common culprit at times, because you have to, first thing is, if you're having problems with any skin problem, try to list all your products which you are using at home. Detergent is on the top, any soaps or your makeup products, and then one after another you keep changing it and see that which product is causing. So that is extremely important. Sometimes perfumes are very very, very troublesome. So you have to make a list of all your products. It's not an easy thing. It's pretty difficult to do, but at least you rule out which is causing it and take that thing out instead of taking too many medications, too many liquids you are using to cure these things. But first of all, find the cause which is doing it. So that's extremely important, and it's very difficult.
Wow, now that's some great info. Now moving on to our next question, eczema can be spread by skin-to-skin contact.
No, that's not true. But it can be genetic, actually. Eczema, as I said earlier, it can be genetic.
Good to know. Now our next question is, a person can either have only dry skin or only oily skin.
It can be both. So if my face is oily but my legs are dry, so I still can have eczema on both places, because maybe I have eczema in my family, so my genes are prone to having eczema. So it's genetically I'm having prone eczema skin. So in that case, I can have either skin, oily or dry, and I can have eczema.
I see. So there's no way to actually just categorize that you can be either one or the other. It could be a combination as well.
Absolutely.
I see. Now that's all for the questions that I have for you today. Thank you again, doctor, for joining us. I'm sure our audience has learned a great deal about skincare today.
I hope so.
Now that's it for this installment of Your Health, Wealth, Happiness, and Spirit. Please don't forget to subscribe to our YouTube channel and be sure to check out our website, yourhwhs.com. We will see you next time, but until then, stay happy, healthy, and live better.